How do STD symptoms differ between men and women? Have you ever wondered how sexually transmitted diseases, or STDs, show up differently in men and women? Understanding these differences is crucial for early detection and treatment. The symptoms of STDs can vary significantly due to anatomical and physiological differences between the sexes. Generally, men often experience more noticeable and localized symptoms. For instance, they may have urethral discharge or painful urination. This is because the male urethra is longer and more exposed. On the other hand, women tend to have subtler symptoms that can be less specific. This can lead to delays in diagnosis since infections can be hidden within the female reproductive system, including the vagina, cervix, and uterus. Let's look at specific STDs to see how symptoms differ. For chlamydia and gonorrhea, men usually report a burning sensation during urination, penile discharge that can be white, yellow, or green, and sometimes testicular pain or swelling. Women, however, may notice an increase in vaginal discharge, burning during urination, lower abdominal pain, and even bleeding between periods or after sex. Many women might not show any symptoms at all, which increases the risk of complications. When it comes to syphilis, both men and women develop a painless sore known as a canker at the infection site. In men, this sore is often on the penis, while in women, it may appear on the vulva, cervix, or inside the vagina, making it less visible. Secondary symptoms like rashes and swollen lymph nodes can occur in both sexes but might be overlooked in women. For herpes simplex virus, men typically have painful blisters on the penis or around the anus. Women can also develop blisters, but they may appear on the vulva, vagina, or cervix, leading to potentially more severe discomfort due to their internal location. Human papillomavirus, or HPV, is often asymptomatic in both men and women. However, in women, persistent infections can lead to cervical changes detectable by Pap smears, which may eventually lead to cervical cancer. Men might develop genital warts or, in rare cases, penile or anal cancers. In the case of trichomoniasis, men often do not show symptoms but may experience urethral irritation or discharge. Women, on the other hand, may experience vaginal itching, a frothy yellow-green discharge, and discomfort during urination or intercourse. Lastly, for human immunodeficiency virus, or HIV, early symptoms can be similar in both men and women, including fever and swollen lymph nodes. However, women may experience more frequent yeast infections or menstrual irregularities as the disease progresses. It's important to note that women are at a higher risk of complications from untreated STDs, such as pelvic inflammatory disease, infertility, and ectopic pregnancy. This is largely due to the internal nature of female reproductive organs. Additionally, men who have sex with men may experience rectal symptoms with certain infections. In summary, men often have more overt and localized symptoms, while women's symptoms can be less specific and sometimes internal. This can lead to delays in diagnosis and serious complications. Both men and women should seek regular screenings and consult healthcare professionals if they are exposed or show symptoms. Early detection and treatment are key for maintaining sexual health and preventing long-term issues.